We will be deploying them, but there are conditions for the deployment because they're a little bit less sensitive. So at the beginning of someone getting infected, they're not as effective as to detect the infection. But if you wait a few days, then they become more effective at detecting the infection. So with the antigen tests, our protocol and the WHO protocol suggests that you use them when somebody displays signs or symptoms of COVID-19. So if somebody got a fever, if somebody is complaining of fatigue, headaches, all the typical signs and symptoms of COVID, if they have lack of smell, lack of taste, these are all signs that we will look for. And once people are displaying these signs, we will be able to do the test. Once we do the test, it's a very simple test to be done actually. So just like with a PCR, you have to swab the person. And once you complete that swabbing, you take the swab. There are little tubes that you'll have. You put them in there. There's a special set of reagents in the tube. You twirl it for maybe 3 or 4 times. And then you take droplets from that tube and you put it onto a testing board. And once you put the droplets there, you wait for 15 to 20 minutes, and then you'll see some lines appear, which would indicate whether the person is positive. So once those lines are there, you know the person is positive. So it's very simple, and you can see it as it unfolds. So we thought that it's important to use this, especially in some of the areas where it's challenging to do the swab and then send the swab out to the national lab, that once people display signs and symptoms, they're in a hard-to-reach area, that these tests becomes more important. So that's why we're deploying them. The PCR test is still the gold standard for testing. And we still have that. We still have the capacity to do that. We have increased that capacity, because we've constantly been adding equipment and so forth at the national lab. So over the weekend, for example, we brought in 2 PCR machines and additional reagents, and these are all automated machines. So we would now be able, once we install the machine and put everything together, we will be able to do more than 1,000 PCR tests per day. I would say we can comfortably do about 1,500 or more in a given day.